the computer. There we go, please.
And continue. Okay. Okay, yeah, so thank you, Nicola, for the nice introduction. And good morning, everyone from Germany, and good afternoon, good evening, depending where you are. So today, I'm going to talk about how to leverage the Facebook advertising platform for conducting surveys with a focus on the COVID-19 pandemic, and also the research project that we developed here at the lab, at the Digital and Computational Demography Lab, during the first wave of the COVID-19 pandemic. So here's a short outline of this 90-minute session we're going to spend together. And the idea is to really give you the tools to leverage Facebook advertising platform in your research and run your own data collection via Facebook. So I've included here also very practical things and sort of mini tutorials on how to retrieve data from Facebook advertisement and how to conduct surveys via targeted Facebook advertising. And then we'll see an applied example about our research we conducted via this cross-national online survey called the COVID-19 Health Behavior Survey, plus other examples of research study, especially on survey studies during the COVID-19 pandemic. Yeah, and I will share the slides after the talk, so don't worry to take too much notes. So first of all, why Facebook? Well, Facebook is currently the largest social media network with 2.8 billion monthly active users worldwide, with a nearly global coverage and high spatial resolution. Think, for example, that the data collection scheme allows you to set the spatial parameter up to 1 kilometer radius around the point of interest. So it's really detailed. And then another main reason is the possibility to target specific groups of people you're interested in your research, from their demographic characteristics to specific interest in topics, education, affiliations, language use, and so on and so forth. So it becomes, in this way, it becomes easier and feasible to target also the so-called hard-to-reach populations, that is those subgroups of the population that otherwise would be difficult to reach or involve in your research otherwise. Another main point is that data collection can run continuously and can be either free of cost in case of digital censuses, where you retrieve the data on the audience size of your population of interest, or can be cost effective in case of survey research compared to other traditional survey methods. And in both cases, we'll see that the interface and tools provided by Facebook are very easy, intuitive, fast, and flexible to use and implement. And more importantly, those tools are open to all scholars with no need of cooperation with Facebook itself. So Facebook business models center on targeted advertisements to basically provide advertisers with a tool to speak directly to their intended audience and maximize in this way their reach and profit. And here you can see a screenshot of my homepage, which I found particularly interesting to show you an example of how targeted advertisement work. So you can see here, for example, in the timeline, an advertisement from UNICEF, which seems to be targeted according to my interest, but country-specific, because despite my profile is set in English, the ad is in German and clearly targeted to people living in Germany, no matter the language profile. And the second ad on the right column instead is promoting some sort of credit card or bank account for expats. And this is the classification that Facebook automatically infer based on users' behavior on the social network and provide as a tool to advertisers to target the intended audience specifically for their advertisements and for their business in the end. So the idea is really to act as an advertiser here and leverage those tools that are provided by Facebook for business purposes, but translate them into a powerful way for data collection scheme. So how it works basically. The advertising is technically implemented through Facebook Advertisement Manager, which allows advertisers to create ad campaign that can have different goals. So for example, creating interest for a specific service or for a specific product, generating traffic to an external website, as we've seen before with the example, with the credit card example. And here in this interface, there are two main aspects that I want to highlight. The first one is the targeting criteria that you can define, that you can use to define the intended audience, which is then your cohort of study. And each advertising campaign can target specific groups of Facebook users, which can be defined based on several features. And these features can be either self-reported by users, like, for example, age or gender, or inferred by Facebook based on users' behaviors on the social network. And then once you define this audience, and before the advertisement is launched and before any cost is charged, Facebook provide the information on the audience size. That is like how many people, how many users match the given criteria in this specific group. And apart from the audience size, it also provides the estimated number of people that your ad can potentially reach, and the number of clicks that your ads can potentially generate in that specific audience and given the budget you plan to spend. So let's see a concrete example of targeting criteria that we can use to define an audience. So first of all, I said before the location. You can select user location, which is very flexible and detailed. It can be in a country, a region, a city, or you can even give latitudes and longitudes of your point of interest and select the surrounding 1 kilometer radius area. And this parameter, I believe, depends on the Facebook you are like on the platform you're using. It's 1 kilometer radius in Europe, but I think it's like 3 miles in US, if I'm not wrong, so you can change it from country to country. And then you can play also with this feature, include, exclude, to customize really your own location of interest. And in addition to this, you can select also user location based on the definition provided by Facebook, which can be the residence, the most recent visited location, or the most recent visited location, but 200 kilometers away from your usual residence. So it can be very detailed and flexible. And the same thing with other targeting criteria based on demographic characteristics. For example, age, you can give ranges. With gender, you can select men, women, or both genders. You can select education, specific interest in topics, language use, and so on and so forth. And then, as we said before, once you define this, you get the size and potential reach of your ads in this specific audience. Now, with these characteristics in mind, Facebook advertisements have been used, have been now largely used in research, mostly in two ways, either for conducting digital censuses to measure some characteristics of subgroups of the population, or for recruiting respondents from subgroups of the population to participate in surveys. And both research types leverage the detailed demographics and users information provided by Facebook to define the target audience with the possibility, as I mentioned, to target also hard to reach populations, which otherwise would be very difficult to involve in your survey study. In both cases, data collection can run continuously. As I said, it's free of cost in the case of digital censuses because you're just retrieving the data from the platform, and can be it's usually cost effective for survey recruitment. And plus, this is already said, it's very intuitive and easy to use, and I will show you in a moment. So let's start with the use of Facebook advertising for digital census, which now applies to various research fields and make it possible to really collect population data in a more continuous and timely manner than is possible with traditional censuses, and allows also to address social phenomena and research questions that was difficult to address before. And we'll see some example. So probably one of the most prominent examples is this publication in PNAS from Garcia and collaborators who used the Facebook advertising estimates to measure the digital divide worldwide. And in particular, they collected the estimate of the daily active users by gender to quantify the Facebook activity ratio by gender and create this Facebook gender divide index as the logarithm of the ratio between the activity ratios for women and for men and for women. So that these indicators basically show the gender specific tendency of activity on Facebook. And if it is below 0, means that women tend to be more active on Facebook compared to men, and if it is above 0, means that men are more active on Facebook than men in a country. And this is a clearly prominent example of using large-scale, inexpensive data for measuring gender inequalities in real time and worldwide. Similarly, in this study from Fateki and collaborators use, again, Facebook advertising data to build a gender gap index. So similar to the previous study, they create this index as the female to male gender ratio, but this time is scaled on the general population in order to correct for imbalances in the Facebook population. And as part of this project, they also created an interface where you can really see update in real time on the digital gender inequalities as measured via Facebook and other data sources. And so you can really track in real time the progress in women participation in the digital revolution and its opportunity. Facebook advertisements as data have also been used in the field of migration as non-traditional sources of data for estimating stock of migrants and provide insights that can improve migration governance and assist policymakers, especially due to the high spatial resolution and coverage of Facebook data. And I believe this is the last example. Facebook data has also been used as a novel technique for digital disease surveillance. And this study from Chuna and collaborators investigated how whether some Facebook categories related to activities or more sedentary interest, like watching televisions, are associated to obesity prevalence in the US as reported by traditional data sources. So this was just a glimpse of the research studies showing how to leverage Facebook advertising data to measure characteristics of the population that otherwise would be difficult to observe with traditional data. So now in this sort of mini tutorial, we'll see in practice how to retrieve the audience estimates from Facebook advertising for your research purposes. And this is possible via the Facebook marketing API. which, among other services, allows to get the total audience size of specific target population on Facebook. Then, in order to access this marketing API and be able to retrieve the audience estimates from Facebook, you need to follow some simple steps to basically obtain some parameters that you need to set and use in your queries and in your code. And here there's the documentation if you want to learn more, but basically all you need is of course, first of all, a Facebook account, which needs to be valid and not newly created. In this case, if you create a new Facebook account, I think you need to insert a number of information or wait some time before you'll be able to use the Facebook marketing API. After that, you have to register an app and generate an access token for your app, which is basically a string that gives you permission to access the Facebook APIs and then obtain your account ID. So the first step to register an app, you basically go to this interface, developers.facebook.com, that is the platform intended for Facebook for developers, which is connected to your personal profile. And here you can just simply create an app, click on the button, which needs to be a business app type in order to be able to manage the features related to Facebook advertisements. So when you get on this window, you just select business and then you continue. And then you'll be asked some details about your app. For example, the name of your app, your email address, the primary purpose of your app. That is in the sense of the type of use in accessing and using the Facebook platform, if personal, of behalf of clients. So here you select personal use and you finally create your app. The next step is to get an access token, which you need to identify your app and grant use of Facebook API. So here is your app dashboard. You click on the marketing API, which leads you to this page where you have to do the last two things. First is you have to check the API version and save it somewhere, because it's just a parameter you'll need to set in your queries. And second, you have to select the token permissions you need. And in this case, is the ads management permission. And after that, you just get your access token. And again, you copy and save this token somewhere because you need it in your queries, in your code. Last step, you need to get the ad account ID. So you basically just follow the link to Facebook Advertisement Manager, and whatever string you get here in your link, this corresponds to your account ID. So now that you have everything basically, and if you are a Python user, you can access the Facebook Marketing API through this Python package, which is quite simple to use and like a lot of functions already implemented. And basically, you just need to initialize your advertisement account with the parameters you got in the previous steps. So the API version, the access token, and the account ID. Then you select the target options, the target populations you are interested in according to the options we've seen before. And then you get the total audience size in form of either daily active users or monthly active users. But usually the daily active users is less stable over time and subject to change. So it's usually recommended to collect the monthly active users in this case. Okay, now the second type of research we're going to see today is instead maybe the more relevant for this presentation is on using Facebook advertisements for survey recruitment. which so far has only a few studies, but has really great potential, especially to run cross-national survey in a timely manner, and perhaps when other study settings are not possible, for example, during natural disasters, conflicts, or pandemics. So all the studies so far tend to showcase how sampling a specific population is possible and feasible via targeted Facebook advertisements compared to other traditional methods, especially when appropriate survey design and recruitment strategies are used and implemented to target the correct population of interest. And for example, this study aimed at sampling specifically Polish migrants in 4 European countries, including Ireland and UK, which are the primary destination of Polish migrants, of Polish migration. Or sampling, for example, German immigrants globally to understand, for example, individual motivations, migration processes, and to eventually develop a comprehensive understanding of global migration dynamics. And for this, Facebook offers really an unprecedented opportunity to recruit respondents timely and across countries. So now the second part, we'll see in practice how we can leverage the tools provided by Facebook for business purposes to implement survey data collection via targeted advertisements. And in practice, implementing a survey project via Facebook consists of various steps, which requires more than the design of the questionnaire. And this is a sort of reminder for you, which includes also, for example, creating the tools you need to manage the recruitment of participants and the recruitment strategy itself. And then, of course, the implementation of the online survey. So first of all, what you need is a project page on Facebook, and this is needed to launch and manage the advertisements themselves, but it is also sort of window on your project that allows to learn more about who is sponsoring the ads, what the study is about, and so on and so forth. So the suggestion here is to keep the study page as detailed as possible, with, for example, the logo of your institute or various affiliations of researchers, contact details, and so on and so forth, in order to build trust with the interested users, but also to keep it as active as possible to engage users and increase your visibility when you compete, when your advertisements compete with the others. Second step is the advertising strategy, which basically means defining your audience based on the targeting criteria we've seen before, and targeting defining the specific elements you want to use to speak to that to your intended audience and engage them filling in your survey. So the advertising campaign consists of 3 different levels, as you can see here in an example of the structure of the advertising campaign. And we'll see in a moment how it works in the Facebook interface, but just to give you an idea, the highest level is the advertisement campaign, which is basically the object containing your advertisements, your definition, and various metrics. At this level, when you create a new ad campaign, you define the goal of your campaign, which is in this case generating traffic to an external website so that people get to visit your survey. The second level consists of the ad sets, where you define your target audience and also the budget you plan to spend to reach that specific audience and the schedule for each ad set. And then the third level consists of the advertisements themselves. Each ad set can consist of different advertisements, which can differ, for example, in the ad content in terms of different images, text, different links, videos, and so on and so forth, in order to optimize the delivery of your advertisements. So this is the general structure to keep in mind when creating a new advertising campaign via Facebook. And now we're going to see how to do it step by step, which is sometimes tricky, but also simple if you follow like the documentation provided by Facebook. So the Facebook interface is the place where you can create and manage advertising campaigns and monitor various metrics to measure basically the success of the delivery of your advertisements. Here, first step is to create a new campaign and define the object, as I mentioned before, which in this case is generating traffic to an external website, which is going to be your survey. Second step is to define your ad sets. And here, where you get to define the budget, which can be either daily or for a fixed duration, the schedule for your ads, when they are supposed to start running, and if they should run all the time or preferably in a specific moment of the day, and so on and so forth, and then your target audience, matching the criteria for your cohort. And in the last step, you get to create and customize your advertisements in terms of the platform. For example, if you want to use only Facebook, Messenger, or Instagram, the position of your advertisements, whether in the timeline, in the right column, in the stories, and so on and so forth. Which device you would like to reach, which operating systems, and many other features that you can really select to be very as specific as possible in case you're interested in a very specific type of population or a research question you may have in mind. The advertisements themselves then need to be linked to a Facebook page that we've seen before, which are sponsoring the advertisements. You can add at this stage the images or videos or other media you want to include in your ads, and include some text to describe your project and engage users. And finally, the website you'd like to promote in your advertisements, which is the URL of your survey. And that's it. So before your ads start running on Facebook, they are automatically reviewed by Facebook to check compliance with the all the sort of advertising policies, and these usually take 24 hours. So if you schedule, for example, your ads to start running on a specific time or date in the future, they go through revisions as soon as they are published, but won't start running until your start date or time. So after that, your ads will start be delivered to your target groups, and you can monitor their reach via Facebook Advertisements Manager interface. And you can monitor also a bunch of other indicators such as the budget, but also other metrics like the number of clicks or impressions, which tell you the reach and interest in your ad. So now maybe this is a good moment to have a couple of minute breaks, and I saw there were some questions. Maybe I saw in the chat. How do I see the chat?
The chat is on the bottom. I think you see it. Rui mentioned before when you speaking about maybe she want to speak about her experience a bit on that.
Hi. Yeah. So I'm a social psychologist, and I also use Facebook ad for surveys. Compared to other traditional methods of how we recruit participants, like either from the university or from other survey panels, what we notice that some participants participants like recruited from social media such as Facebook, they're really not very friendly. They have a lot of untrust toward why we're doing this, why we're collecting their data, etc. So and also what we found that the money we spend on the Facebook ad is also not cheap at all, especially if we invite participants for attending some surveys, we have to pay the participants themselves. So on top of that, Facebook ad also charges quite a lot if you want to recruit the amount of participants you want. So unless you're based in MPI and have endless resources for using Facebook, it may not be suitable for every single group or person who wants to do this. That's my brief comment on this.
Yeah, thank you for this comment. Actually, so for the first comment, participants, untrusting participants, we also had this issue at some point, but specifically it was kind of country specific. For example, we saw that, so I'm going to talk about our survey in a moment, but we basically had different countries. We were running the survey in Europe and United States. And for example, we saw this positive response from participants in Italy, where really, like, even the comments below the advertisements were really friendly, like stay healthy, take care, and all this stuff. And instead, other countries, for example, UK and US, were more like, oh, like what is doing this German organization in my Facebook, this is scam, and all this sort of comment. So one way to address these kind of behaviors, and that was really our experience. I believe there's not much research on this. It was really to try to engage with users, so try to answer also this comment, so that when new users, new Facebook users saw our ad, below the ad there were already some comments, so to build trust, like this is not scam, you can see our, I don't know, data protection policies here, you can see our paper we just published, we are researcher, and so on and so forth. Another kind of methodology that other researchers have been used is to hide the comments, but that way I don't think it's a good way to build trust, because if you see like an advertisements with no engagement, with no responses from participants, maybe it's even less useful to engage them to participate in your survey. As for the cost, so in our study, for example, we paid on average €1 per completed questionnaire, and we didn't give incentives to participants. And despite this, despite we didn't have incentives, the participation rate was high. And I don't know if this is the case because COVID-19 was really the interesting topic at the time. I mean, we started in March 2020, so it was really the topic at the time. So people were seeing us in the timeline and were just interested to see what was that. So, and then depends also on the specific audience you are targeting. So if you are more specific, of course, your audience size is limited, so you have to spend more to reach those people. And this is, for example, something we, for example, the cost was €1 on average, but for some specific demographic groups was more expensive. For example, I don't know, the elderly or some region, for example, in the south of Italy. So this really depends on your audience. If it's really small, then it's the cost is higher, of course.
Yeah, I totally agree with your experience. I also experienced this. We collected some data in Africa as well during the early pandemic. And then some countries, like, we do encounter pretty good feedback and some others not so much. And like a UK specifically bad. So yeah, indeed, it depends on the country. Yeah.
Good. Let's see.
Can I ask you a question?
Yeah.
Thank you very much. So this was extremely informative. So I'm really impressed. Can you comment a little bit on the sampling bias that is involved in this Facebook survey? So how representative are these surveys? I mean, is there any way to measure, or can you refer some to some studies that analyze this sampling bias? And my second question is, what is, like in your own experience, what was the percentage of participation? I mean, what percentage of people who saw your ads actually did fill in the survey? Do you have data on that? Maybe you will be talking about that.
Yeah, actually, can I answer your question as we move on? Because I will cover both your questions. So
okay, perfect. Thank you.
But thank you for asking. This is really the interesting questions. And then I saw there was another one. Other two questions, actually. One from Irma. So I'm sorry, I didn't understand the role of the ad itself in your first example, the digital census. Could you explain it a bit more? Yeah, so in the first example, in the digital census, there's no, basically the part of creating an advertisement is not there in that example, but the way you can access those data is because Facebook provides this tool called Facebook Advertisements, which give you the opportunity to collect the data. So the idea is that this tool is meant for advertisers to reach a specific audience. And we can translate this tool in research purposes and collect those data. So what we collect for the digital censuses are the audience size, which are meant for the advertisers. I don't know if it was clear. Maybe you wanted to say more? Oh, no. Okay, thank you. Okay, and the second question from Rabia, I will also address that question in the second part in our COVID-19 health behavior survey. Nicola, can we have like 5 minutes back and then come back? Okay.
Absolutely.
Okay,
so
great.
We convene, shall we do 8 minutes just for measure, and we convene at 12:50.
12:50, okay, perfect. See you in a moment.
Sure. So basically in 6 minutes, if you want to grab some coffee and roam around, please feel free. If you're ready, Daniela, please.
Yeah,
Away
thank you.
as you
I really needed to refresh one moment.
Sure.
Okay, let's show it. Here we go. Okay, so thank you first of all for the questions. I'll try to answer some of them during the second part of the presentation, and if not, we can discuss more at the end of the presentation. So now I'll basically explain. I'll show you an application of the methodology we've seen so far with the COVID-19 Health Behavior Survey, which is a survey we carried out here at the Lab of Digital and Computational Demography during the first wave of the COVID-19 pandemic using targeted Facebook advertisements. And first of all, let me acknowledge the research team involved, whose background and expertise in different fields from statistics to computer science to sociology made it possible to set up a survey data collection in a timely manner at the very early stage of the COVID-19 pandemic in several countries in Europe and United States. So the data collection is based on this COVID-19 Health Behavior Survey, which is a cross-national online survey that we conducted continuously since March 13, 2020, in a total of 8 countries in Belgium, France, Germany, Italy, Netherlands, Spain, United Kingdom, United States. We designed the survey in a way to cover several topics, including the socio-demographic characteristics of respondents, health indicators, social contacts, behaviors and attitudes related to COVID-19. And here you see a screenshot of the homepage of the survey in the United States with a short description of the study, the duration of the survey. It was like between 10, 12 minutes, contact details, and electronic informed consent to participate in the study. And participants reached this page via Facebook through this type of targeted advertisements that we created using the Facebook advertisement manager that we've seen earlier. And this is an example of the advertisement we use to target groups of Facebook users in the United States, for example. So the ad was sponsored by our project page on Facebook, so that if people click on the page, they reach the project page with all details about who we are, what the study is about, and as I mentioned before, this is a way to build trust and to show that there is a scientific study and researchers behind those advertisements that people see in their timeline. Then the text of the ad was something really short, engaging, and possibly speaking to our intended audience. For example, here we were addressing people living in the United States. So it should be court specific if possible. And finally, we invite them to participate in our survey so that when they click on the Learn More button, they jump to the homepage of the survey. And the ad is basically the same in terms of content, but targeting different groups of Facebook users, as we defined in our advertising campaign. And in particular, in our study on COVID-19, we thought it was important to get respondents as homogeneous as possible from different demographic groups, as the response to COVID-19 may change based on different risk groups or, for example, epidemic situations across different regions. So we opted to target Facebook users by country of residence and demographic variables, including sex, age, and region of residence. And we structured our ad campaign, as you can see here, So one ad campaign per each country in the study. So we had 8 different ad campaigns in total, one per each country. For each campaign, we defined one ad set per each demographic group. So it means that one ad set per each combination of the demographic variables. So we had 2 options for sex, like male, female, 4 options for age group, and a variable number of options for the region of residence, depending on the country. So we had from 20 to 60 ad set per country. And lastly, for each ad set, we created 6 different advertisements with the same content and structure, but with 6 different images in order to diversify the sample of respondents. So we had, for example, images more related to COVID-19 or influenza-like illness, or more neutral, showing some healthy behaviors in terms of food or physical activity. So one useful indicator to monitor during the ad campaign is this click-through rate, which is basically the ratio of users who click on the ad to the total number of users who view the advertisements. So this impression is the number of people who saw the advertisement in their profile. And this is basically a measure of the success of your online advertising campaign, and provides also insights into, for example, interest in your topic among the Facebook users. So here, for example, we see a clear trend. Over time, the click-through rate was initially high across all countries, and then it decreased before ultimately increasing again. And this means that, for example, in the early phases of our survey, in March, beginning of April, Facebook users were more likely to click on our ads than in later phases. In combination with the click-through rate, we can also monitor the response rate, the participation rates, in terms of the number of people who completed the questionnaire compared to the number of people who clicked on the ad and reached the homepage of our survey. And here in the plot, you see the participation rates by country, sex, and age group. And you see that the response rate was generally high, except for Spain, where, for example, the cost for questionnaire was generally higher than in other countries. But unfortunately, we don't have any clue why this happened. Perhaps can be that there were other advertisements competing with our advertisements, so it was more difficult to reach people and participants for our survey. And then in general, we see that women were more likely to complete our survey, while participation by age group varies across countries. For example, in Italy or in France, the response rate was higher among younger adults, while in US was higher for more the adults and older adults. Okay, so now with this approach, we've been able to collect data to provide some key insights into the population response during the first wave of the pandemic in Europe and United States. And we'll see some of the studies we carried out in this period. And for example, one example is the social contact patterns that we asked in our survey. As we know, is the main vehicle for the transmission and spread of the virus, and many non-pharmaceutical interventions across countries have been implemented to reduce the number of social contacts in the general population. So in our survey, we asked the number of contacts occurred the day before participating in the survey, and we asked for different settings, contact at home, at school, at work, or in other settings, like in the general community. And here, for example, you see the variability of the social contact patterns over time and across countries, specifically for contacts at home or outside of home, which of course was largely shaped by the various non-pharmaceutical interventions implemented in the various countries. For example, in the UK and US, we were able to capture the decrease in social contacts due to lockdown measures. And in UK, for example, it's evident this long lockdown period, even when other countries were starting to ease restrictions. And especially in this study where we focus in the first week of our observation period, we are looking here at the period between March 9th and April 13, where we could observe the impact of physical distancing recommendations and lockdown measures in reducing the magnitude of social mixing patterns in the population. So these numbers become very valuable, especially when paired with external information on COVID-19 pandemic, such as lockdown measures and other restrictions, to provide some key insights into the effectiveness of the different policies. And when the data, for example, is further broken down by respondents' demographic characteristics, we can also assess the different response of different demographic groups to different policy, also in comparison to social contact data that we have prior to COVID-19 to measure the impact of non-pharmaceutical interventions in the social mixing patterns. Now, another indicator of this differentiated response of the population to COVID-19 is the threat perception that in our survey we asked to rate on a 5-point Likert scale for different levels of society, from the threat perception to themselves, to their family, to their local community, their country, and to the world. And to get a sense of what this actually means, we asked the same questions regarding the threat perception posed by influenza in order to have a sort of baseline to better quantify the threat perception for COVID-19, which, as expected, was way higher than the threat for influenza, of course, given the novelty and uncertainty surrounding COVID-19. And another pattern, the interesting pattern we can see here is in both variables, the threat perception increases from a personal level to more national and global levels, which is even more evident in this plot when we look at the threat perception by demographic groups. So here I'm showing the relationship between the threat perception, the threat of COVID-19 perceived by men on the x-axis and the threat perception perceived by women on the y-axis across different levels of society, which is indicated by the color code, and different age groups indicated by the size of points in the scatter plot. And here we can observe a couple of things, right? First of all, this interesting pattern in how respondents perceived higher threat nationally and globally than personally. Secondly, the threat perception was higher for among women, except for the threat to oneself and to the family for people aged 65 plus, and we're going to see in a minute. And the third thing is that the younger people were generally less concerned and perceived lower threat compared to older people, with the exception of the threat perception to oneself and to the family. Which we can observe here that while the younger people perceived moderately low threat to themselves, this was significantly higher to their family. And instead, the older adults perceived moderately high threat both to themselves and to their family. And this difference basically disappears when we look instead, for example, at the threat perception at national and global levels. So what what this actually means. So the threat perception can serve as sort of indicator of the level of awareness and concern in the population. And more importantly, if it's age and gender specific, it's relevant because it translates into the efficacy of communication campaign and consequent adoption of preventive behaviors. So for example, the fact that younger people perceive higher threat to their family and to and older people perceive higher threat to themselves. This translates into high levels of awareness, given that we know older people are at highest risk of complication following an infection from COVID-19. And I'll get back to the gender-specific pattern in a moment with the adoption of preventive behaviors that we observed in our sample. Which we measured in order to assess whether people actually changed their behavior and complied with the recommended mandated public health interventions, which is critical for policymakers to design effective communication strategies, increase situational awareness, and evidence-based decision-making. And for example, our data, among others, have been used in a report focused on the use of face masks in the general population to basically push the public health authorities in the UK and encourage the use of protective face masks, which in UK was really low at the time compared to other countries in Europe. Now, in our survey, we cannot really capture changes in behavior at the individual level, given the cross-sectional nature of our study, but we can measure the adoption of preventive behaviors across different demographic groups and over time. Now, if we zoom in, for example, in the use of face mask and increase the hand hygiene, we observe some interesting patterns here. So in this observation period, which was until week 16, 2020, so means mid-April, end of April 2020, the recommendation of using face mask in a public or closed space was still at the early stage, but still we observed rapidly adoption of face mask in the population in most of the countries, which may be an example of rapid change in behaviors in the population, especially if we think that we are talking about contemporary Western society where wearing protective face mask in public was not common. On the other hand, if we look at the increased hand hygiene, we observe high levels of uptake, which remains fairly constant over time with no significant differences across age groups, but higher for women. So again, with this gender-specific pattern that we observed in the adoption of preventive behaviors, as well as in the threat perception we've seen before, this can be particularly relevant, as we know that the case fatality rate for COVID-19 is substantially higher for men than for women. So we might expect that men are more concerned and more likely to take measures to protect themselves. And instead, our results and survey data in general show that this is not necessarily true and suggest that probably gender-based communication campaigns may be more effective. So now that we've seen this pattern in the single variables across demographic groups, we can pair this information and investigate their association, looking specifically at vulnerable populations, which may have had a differential behavioral response to the COVID-19 pandemic to protect themselves due to, for example, pre-existing health conditions or old age, or, for example, co-residence with these individuals. So in this study, we looked specifically at whether vulnerability threatens the association between the threat perception and the use of face masks in different subgroups in our population sample. And again, in this study, we focus on the initial period between March 13 and May 7th. 2020, when basically the public health recommendations of using face masks in public or closed space was still in early stage. So here in the heat map, I show the relationship between the adoption rate of face mask indicated by the color code and the levels of threat perception of COVID-19 to oneself from very low to moderate to very high by country. And we observed that the adoption rate of face mask increased substantially as the threat perception increased. And if we look, for example, Germany, the adoption of face mask increased from 70% for respondents who perceived very low threat to 47% for respondents who perceived very high threat to themselves. And considering now those vulnerable groups we could identify in our survey, such as the older adults, people with comorbidities, people who got the flu vaccine, households with people aged 65 plus, and households without people aged 65 plus as a sort of baseline to assess the outcome of non-vulnerable groups. Here we see the relationship between the threat perception by these groups and by countries. So we observe that, for example, the threat perception is basically clustered by country, from the lowest one, Germany, to the highest one, the United Kingdom, and that the threat perception is consistently higher for people with comorbidity, followed by those vaccinated for influenza and those aged 65 and over. And while for the living arrangements, this further confirmed how people living in vulnerable households with members aged 65 plus perceive higher threat compared to people living in non-vulnerable households. And these findings are further supported statistically. We used this bivariate model and we found strong evidence of the increased high threat perception and wearing face mask for people with vulnerabilities. For example, across all countries, we found that all individuals with a certain type of vulnerabilities, that is being an older adult, having a comorbidity, or living in households with at least one older adult, and being vaccinated for influenza, were more likely to wear a face mask than those having these, not having these characteristics. For example, the households without people aged 65 plus. Now, the survey data that we collected in our work can also help answer some other research questions, so not related to COVID-19, but more on the methodology and validation of using Facebook for digital censuses and recruitment platform. So if you remember at the beginning, the literature on the digital censuses, the validity of those studies basically rely on the reliability of the data that underlines Facebook advertising platform. So in this study, we took advantage of the data we collected in our survey and the variables we used to target Facebook users to measure this mismatch between the two. And this is possible because for each respondent in our survey, we know from which advertisement they arrived in the survey, and we were able to check if the demographic variables we used as targeting variables match the information reported in the survey, at least for the central demographic variables that we used as targeting criteria, that is gender, age group, and region of residence. So now this table shows the proportion of respondents who were classified correctly on 0, 1, 2, or 3 characteristics by country. So from 87 to 93% of respondents were classified correctly on all 3 characteristics, meaning that gender, age, and region of residence that Facebook used for targeting respondents in the advertising campaign matched with the answers, with the responses that participants reported in the questionnaire. And typically, if there is a mismatch, this interests only one characteristics, which is less than 2% had only one or no matching characteristics. And we can assess for which characteristics the misclassification were most likely to occur by computing the accuracy across countries. We see here in this table the classification accuracy was highest for sex, somewhat lower for age, ranging between 93 to 96%, while for region of residence, we observed it was significantly lower in Belgium and United Kingdom. Skip this slide. So when we look deeper at the level of precision across region, we observe that the issue is in particular in Brussels and London, while for the other regions, the precision is over 0.9, meaning that respondents, the region reported by respondents often matched the Facebook classification. And here you see, for example, for Belgium, on the left side, the region where respondent reported to live in our questionnaire, and on the right side, the region to which Facebook assigned them. And you see that the issue is basically around these two regions surrounding Brussels, where many people reported to live in, but were categorized by Facebook as living in Brussels. And this is probably due to the fact that user location on Facebook are estimated based on several pieces of information from the mobile device, IP address, and self-reported information, and so on. And so these users possibly are classified incorrectly due to, for example, commuting to the city. And something similar in the UK, where most of the misclassification for London concerned people who reported to live in the surrounding region of east and southeast of England. Okay, of course, our study comes with limitations and challenges. So first of all, we know that online samples are generally biased due to non-representativeness. In our case, for example, we oversampled women who we know from the literature that they are generally more interested and more likely to engage in health-related online activities like surveys, blogs, forums. Participants were mainly adults aged between 25 and 64 years old, while the youngest and the elderly were somewhat difficult to reach, probably because of different usage of Facebook or lack of interest in the topic in the survey. So what we can do to solve this issue, basically two ways. First wave is to stratify advertising campaign by targeting different demographic groups, as we did in our study. And this way you ensure the diversity in the sample, especially if you use using all characteristics that are likely relevant for the study, for your study. And the second solution is applying post-stratification weights to reweight your survey data on the general population, as we did in all our study, in order to correct for this bias in our data and ensure that our estimate approximate a representative sample of the population, at least in the central demographic variables. Another issue we often encounter in online surveys is the self-selection bias of participants, and tentative solution to this is to use different materials in the advertisements, as for example we did in our study, using 6 different images in order to diversify the sample and check also how the advertising material relate to responses in order to assess how the self-selection may affect answers. So, for example, in this table, we assessed the threat perception of COVID-19 by image, and we see that despite the participation rate varies a lot across different images, the threat perception was quite high and consistent across all images. Another issues I want to mention is that the definition of the targeting variables used in the Facebook interface sometimes or often are black boxes. So in our case, we were able to show that at least for the central demographic variables like sex, gender, age, and region of residence, the Facebook classification worked well. For other study, perhaps involving more detailed targeting criteria, more specific small audience, the suggestion is to conduct a small pilot to assess whether this classification of the users in this group is correct or need to be adjusted somehow. Okay, now very quickly, and then we'll move to questions. I wanted to point to at least 2 other big survey studies that were conducted on Facebook during the COVID-19 pandemic. So the first one is the initiative from Facebook itself in partnership with the University of Maryland and Carnegie Mellon University, who basically joined forces to leverage the large sample population in Facebook along with expertise in survey methodology to run this large-scale and nearly global survey study, recruiting participants via Facebook on a daily basis to report on different topics from symptoms, social distancing behavior, beliefs, knowledge, vaccine acceptance, mental health issues, and so on and so forth. And these survey data are intended for policymakers, public health officials, researchers, in order to provide key data and also tools for continuous monitoring and rapid response. And this is, for example, a dashboard they created to show details on the COVID-19 symptoms by region and over time, along with a bunch of other indicators like the number of cases, deaths, hospitalization, and so on and so forth. You can access the aggregated data from US and non-US countries, which are published, I believe, daily via public API and dashboards. Otherwise, you can also request non-aggregated data upon data use agreement signed with Facebook and the university involved. The second example is instead an initiative of MIT in collaboration with Facebook and Johns Hopkins University, and it looks specifically to beliefs, attitudes, behaviors related to COVID-19. The data collection ended in March 2021, and they collected data from more than 70 countries. And also in this case, access to aggregated data is possible by API, otherwise access to non-aggregated data possible upon request and data use agreement. So three take-home messages from this presentation I would like to leave before concluding, before going to the Q&A. So first of all, our work on Facebook surveys is placed in this huge effort we've been witnessing over the past year to collect primary data and leverage alternative data sources to provide rapid insights to increase situational awareness and inform intervention and communication campaigns based on evidence. In our work, we leveraged Facebook, which allows to quickly reach large number of respondents in multiple countries at the same time, which is essential for conducting cross-national comparisons to capture differences across countries at different stages of epidemics, but also with different control strategies in place. And of course, as we've seen, our work comes with limitations and challenges. And my final point here is that although these digital data have been used now to improve our understanding of the COVID-19 pandemic. And despite the limitation and challenging, there's also great potential to translate all these effort in data collection and research into future research to build solid and continuous monitoring routines and stronger system for data collection and rapid response. And with this, I conclude. Thanks a lot for your attention, and happy to go to the chat and answer questions.
Thank you very much, Daniela. Really very interesting talk.
Maybe I'll stop sharing so that we can see the chat more easily. Okay. How much time we have for questions, like until the break session?
Yeah, basically, let's say, I mean, as long as we need, but I would say at least 6 minutes.
Ah, okay. But then we can continue if we have questions.
If there is, if a discussion starts, you can keep it up. Any questions besides those that are in the chat that we will address in a second? Please feel free to type them there. I think that Olufemi made a point about the digital penetration in Africa and possible biases with the data, which I think goes back to the question that Dan was asking in the beginning about internet penetration, Facebook penetration, and possible biases that are there.
Yeah.
Maybe you can comment on that.
So there's a study, I think it was recent last year in Kenya, and they used the Facebook advertising and also survey strategy to as a tool for digital census, but also to see if, for example, the recruitment strategy via Facebook was working in African countries. And I can search for the paper and put you here in the chat because it was really interesting, showing basically it was working, although like despite the limitation we know on the representativeness bias and self-selection we may have, which may be different across countries.
Then Adi asked how if it's possible to compare, because he mentioned that there was some data was incomplete for the latest period for Netherlands. And then he's asking, is it valid to compare Netherlands with other countries where data from, basically, how to compare this data aggregating different time period, I think is the question. Adi, if you have, if I misrepresent your question, please feel free to join the discussion and ask question directly.
First of all, okay, you're saying Netherlands was incomplete for the recent time periods. Yes, because we didn't implement the survey in all countries at the same time. So the data collection didn't start at the same point in March 13 for all countries, but we started with, I believe, Italy, United Kingdom, and US, and then we added more countries as we had capacity for doing so, because all the survey implementation, you have to consider also the part of translation and implementation. We were using Lime survey, and for example, the survey was not quite long, but still it takes time to be implemented, and also the advertisements via Facebook. So that's why there was this delay, and Netherlands, we started, I believe, 1 week or 2 weeks after, and that's why you see incomplete data in that graph. And then your point is in other countries when face mask increases during most recent time period. Yeah, so it increases over time, basically because governments then implemented recommendations. Basically, face mask became mandatory everywhere, at least in closed space like workplace or supermarkets, public transport, and so on and so forth. And so that's why then we focus on the very initial period, in very initial months or weeks, to assess that early stage of implementation of the recommendation.
And then Rui asked how to get in touch with Facebook, basically.
No, okay. So I have no idea. that would be wonderful to do it, because yeah, for example, in our survey, we used our budget from the institute, and we paid, as I mentioned, like €1 for completed questionnaire. But having the large sample available from Facebook and in partnership with Facebook would be amazing. But I have no idea how they started a collaboration. I think they just joined forces because the both MIT, University of Maryland, Carnegie Mellon University have like strong expertise in survey methodology.
Yeah, and some of this, I mean, I spoke with them a bit this year, but through the Data for Good program, which is the one that, I mean, everybody, I guess, can have access to if you talk with them. They were extremely helpful. They're a team for that.
Yeah, but then like if you want to get access to the data they already collected, it's very simple. So we did it for another project. You just need to submit a short proposal, like 1 page, and you get access to the data very easily. So, and they have also different waves covering different topics.
Can I ask you a question?
Please.
This is Erdem. So the reliability data that you provided, was it about those who saw the ads or those who fill the survey? For example, so the people, older people were more likely to fill in the survey or see the ad. So I just missed that point.
Yeah, so the reliability study was with the people who completed the questionnaire, because that's the only way we had like the reported information in the questionnaires on the age and the region of residence, and we could compare those information with the one reported classified by Facebook.
Okay.
So it's like self-reported information on the survey against the classification by Facebook to see if there is a mismatch or not.
The coefficients like 0.9 something, so that were referring to that match, right?
Yeah.
Okay, so you will, I think, upload this PowerPoint presentation, right? I can turn back and have a detailed look.
Yeah. How do you
send it to me then?
I can send it to you. Yeah, of course. I will do it after that. And if you
or
have any questions, like feel free to reach to me directly.
Okay. Thank you. Thank you very much.
Any last pressing question for Daniela before we break up for lunch and a break or breakfast? Depends where you are. Okay. It looks like there are no more questions now. So let me thank again Daniela for staying with us for such a long talk. But I think that we all learn a lot. This is definitely a powerful tool, especially Facebook ads, that we will see, I'm sure, more and more in the research. So I'm very, very happy to that our students saw this type of methodology. Thank you again, Daniela, and then
thanks to you.
Then have a good day. And for everybody else, yes, Erdem.
Yeah, I just want to thank a lot. This was excellent. Thank you.
Yes, thank you again. For everybody else, see you in half an hour. So around 2 p.m. Italian Central European time. See you for my 1 hour and a half presentation about epidemic modeling and some hands-on on Python. So have a good lunch, everybody. I see you in half an hour. Thank you, Daniel, again. Take care.
Thank you, Nicola. Bye-bye.
Bye-bye.